Welcome to Moving Mom and Downsizing Dad, the podcast that prepares you for one of life's toughest yet inevitable moments, stepping in when your parents need you most. Hosted by Chris Spade, a senior real estate specialist with Keller Williams Realty. We'll dive deep into more than just moving. We're talking smart financial planning, making tough decisions with confidence, and strategies to avoid being caught in crisis mode. Join us for real stories, expert insights, and actionable steps to stay ahead of the curve. Now, here's your host, Chris Spade.
And welcome back to Moving Mom Downsizing Dad, the podcast where we help Gen Xers downsize their parents. Today, I am chatting with Esther Sulistio. She is a Medicare insurance broker based right here in San Diego. She's also licensed in Arizona and Texas. Now, after facing challenges with her own insurance agent in 2014, she launched her own business to provide excellent, compassionate service throughout the Medicare enrollment process. Esther is dedicated to helping her clients understand how Medicare works and guiding them towards the best health plan for their needs and their budget, whether it's Medicare Supplement or Medicare Advantage plans. Whatever, she is there for you. As an independent broker working with 11 organizations and a variety of products, she believes in finding personalized solutions because one size does not fit all. Esther lives in North San Diego County with her husband and 2 children, and in her free time, she serves at a local Indonesian church and enjoys teaching Medicare 101 classes at senior centers where her passion for education shines through. Esther, welcome to Moving Mom and Downsizing Dad.
Thank you so much for having me.
Oh, it's a pleasure. It's a pleasure. I'm looking
Yes.
forward to talking to you because it seems like Medicare is this big mystery, and hopefully today we can unpack
Yes.
some of it. But before I get into all the questions I'm going to ask you is this is just a general information purposes only, that if you have very specific questions about your situation or your parent's situation, you need to call Esther because everybody's individual, right?
Correct.
Yeah. So it's just, this is a good general knowledge thing. So
Yeah.
Esther, let's just start at the basics. Can you start
Sure.
by explaining the basics of Medicare and what does it cover and who's eligible?
Yeah, certainly. So Medicare is federal health insurance. So primarily offered for people age 65 and older, but it also covers some younger individual with certain condition and disability. And it is available to any US citizens and legal residents who live in the US for the past 5 years in a row before applying. Also, if you have been receiving Social Security disability benefit for 24 months at least, you can qualify for Medicare. Now, Medicare covers any medically necessary and preventive services, such as the hospital stays or your doctor visit, but it doesn't cover anything. So it doesn't cover, I'm sorry, it doesn't cover everything. So, for example, it doesn't cover your routine dental, your routine eye, hearing checkup, or cosmetics type of surgery or weight loss programs or the weight loss drugs that are currently popular.
Those are very
So
popular.
yeah. So sometimes, people ask me and then, okay, no, sometimes yes. So it depends. And to enroll in Medicare, you need to contact Social Security. They handle the Medicare enrollment. But if you have been receiving Social Security benefit, then you will be automatically enrolled. And once you enroll, then you will get the Medicare card with the white, red, and blue card. And you have the A or maybe the B with the date. And this is what we call original or straight Medicare. Yeah.
Okay, so speaking of that, as we go into it, what are the main differences? Like you just mentioned, Medicare A.
Mhm.
What's the difference between Medicare A, B, C, and Part D, and how do Medicare supplement plans differ, from Medicare Advantage plans? How does all that work?
Right. So there are 4 components in Medicare. There are Part A, B, C, and D, and they handle or cover separate areas. So, for example, Part A is also known as the hospital insurance. It covers the inpatient hospital stay, the skilled nursing facility, the home health, and the hospice care. Um, so I mean, most people don't pay for the premium if they have enough credit, by virtue of paying the taxes for the past 10 years or maybe even longer. So that's why they don't pay for that. Now, Medicare Part B is also known as the medical insurance. It covers the doctor visits, your lab, your MRI, your test screening, the durable medical equipment. So it does has monthly premium that most people have to pay. Um, the cost can be different depend on your income, and they usually check your prior 2 years income tax. And for people who are collecting Social Security, then the premium will be deducted automatically from the benefit. Now, the next two, which is the Part C, also known as Medicare Advantage plan. um, the plans are offered by private insurance company. Usually, the plan combines the Part A and Part B coverage in one plan, and also often include the prescription drug plan or the Part D plan. Plus, it also have additional benefits such as the vision, dental, maybe the gym membership or the
Mm.
transportation. Those kind of bells and whistles that people like. um, Usually and typically have a zero to low premium, depend on what kind of plan that you want. Um, but certainly, all Medicare Advantage plan has a network limitation or
Okay.
restriction. It can
Okay.
be either HMO or a PPO plan.
Okay.
Now, HMO means you must stay in network. You need to get
Correct.
referral to
Hmm.
see your specialist or to do lab or that extra, the next step of treatment. But with a PPO, you can go in and also out of network, but
Right.
there's still this network limitation, right?
Right.
Even though you still can go out of network. So typically in San Diego, the plans can be either again from zero to maybe $45 a month, and this is on top of your Part B premium. So you must continue paying for your Part B premium. Now, the last part, which is the Part D, which is also known as prescription drug coverage,
Hmm.
as the name say, it only cover the prescription drug. So
That's it.
anything that you refill, at your pharmacy and you administer to yourself, um, and that will be covered under Part D. It will cover your, I don't know, brand name drug or your generic medication. Um, the plan also covered by private insurance company, and if you buy a standalone, then there is also a monthly premium that you have to pay. Now, the plan can vary from one plan to another. That's why before you enroll into one, you just have to make sure that the plan you select cover all your medication. Okay.
Okay.
So you also ask about the Medicare Supplement and Medicare Advantage plan, how they're different and how people choose. Well, let me start uh, from Medicare Supplement. So Medicare Supplement is actually a type of insurance. So there is also an underwriting process. If you pass, that's a certain open enrollment. um, the insurance pays most or some are out of pocket costs, generally
Okay.
not paid by original Medicare. And just like original Medicare, the plan allows you the greatest flexibility in choosing any provider, even in the United States, as long as the provider accepts Medicare. So I have client who live in California but see doctor in New York, and
Oh,
yeah,
wow.
it's okay. So yeah, he has original Medicare and he also has Medicare supplement. So that's that's the flexibility you get having a Medicare supplement. Now, the plan also has a monthly premium you must pay on top of your Part B premium, right? And then this premium is usually much higher than the other, just the Medicare Advantage plan. So um, again, this is something that you must think about whether you can afford it or not. Now, Medicare Advantage, it is more affordable, but again, like I said, it has that network limitation, correct? Um, so um, the premium is quite low. That's why it's more affordable. So if you are, you know, the way how you consider this, usually the budget that you have or the premium that you can afford, and also what is your preference. Are you happy with just staying with your medical group, or do you
Mm-hmm.
want the greatest flexibility to choose any doctor you
Mm-hmm.
want?
Mm-hmm.
So that's the two main thing I think. But when this people choose either Medicare Advantage plan or the Medicare Supplement.
So
And
the
also
Medicare,
sometimes.
so the Medicare supplement
Mhm.
is in addition to your Part B, and that costs more than the
Correct.
Medicare Advantage plan, which is more affordable.
Yes.
So if you're
Yes.
on a budget, then the Advantage
Mm,
plan is going to be probably more palatable for someone, correct?
correct. Correct.
Okay.
Yeah. Yeah. And then
Wow,
if they,
that's a lot.
yeah, I know, I know. And if they still want to the flexibility to choose or to go to a doctor outside the network, they can choose a PPO plan. So it's kind of like in the middle, it's more
Gotcha.
affordable versus the Medicare supplement, but you still can go out of network. Right. And
Gotcha.
one thing also, if you travel, sometime I meet people who live here for 6 months, live in the out of state for 6 months, maybe. And Medicare supplement is also a good idea for those kind of people. Yeah.
Oh, yeah. No, well, that makes sense, especially if you're, yeah, back
Yes.
and forth between two states, because California, we have a lot of snowbirds that come here from,
Yes.
the Midwest or Idaho or
Yes.
to come here all winter. So that makes
Yep.
sense.
Yes.
Let me let me ask you this. So when should someone start thinking about enrolling in Medicare, and are there key deadlines that we need to be aware of?
Yeah. So, um, in my opinion, the earlier the better, right? It's a good idea to start thinking about Medicare and the enrollment, and getting all this information several months before you turn 65. But keep in mind, especially your initial enrollment period, because this is your 7 month period around your 65th birthday, right? So it's 3 months before the month of your 65th birthday and 3 months after. So if
Oh,
you miss, yeah, so this is your initial enrollment period. That's very important, because if you miss this period, you may face the late enrollment penalty. So that's why, for me personally, I usually sit down with my new Medicare client at least 4 months before their 65th birthday to explain the Medicare 101, how it works, and to inform their options. And I also want to point out that if you contribute your money to your HSA account, again,
mhm.
sorry, HSA account, you probably also need to know about this, because once you enroll in Part A, you can no longer contribute to it. That's why you need to be
Oh,
aware, and then you need to stop the contribution in time before your Medicare enrollment. So
so once you're enrolled at Part A, HSA you cannot contribute to anymore.
nope, yeah, yeah,
Now, let me ask you
yeah.
this. Do you have to
Mm-hmm.
have your HSA account used up by the time you start Medicare, or can you still use what's in the HSA account up
Yes, you
until
can still use. You
you
don't
can
have
still
to
use
use
it?
it up. Yeah, it's just you can no longer contribute to it
You
when you
can't
have your
contribute to
Part
it.
A.
Okay.
Yeah. Mm-hmm.
Okay.
And
So, This is interesting. See, this is all stuff I did not know. This is why I
Okay.
needed you.
Yes, I'm glad it can be very informational. I hope so. Also for your, for your audience.
Well, so let me ask you, because you did talk
Mm-hmm.
about we kind of rolled into the next question about missing the initial enrollment period. What are the penalties, or if you miss that initial enrollment period?
All right. Yeah. So, if someone missed their initial enrollment period, or we call it IEP for Medicare, then they should enroll immediately. The next change they can enroll, just again to minimize the penalty. They can enroll during the next general enrollment period from January 1st to March 31st,
Okay.
or during the special enrollment period they are entitled to. Maybe if they miss because they have their employer insurance, then they can enroll in Medicare using their ACP when they ready to retire. Now, generally, when you miss your IEP, and you don't qualify for special enrollment period, you may face penalty and you pay your higher uh, Part B premium. Um, and you must pay the penalty as long as you have the Part B premium, your Part B. So it can be lifetime, So try to avoid that. And during your initial IEP, try to get, someone or an agent that you can work with to just get information on this. Now, for Part B penalty, you may have to pay 10% higher of your Part B premium for every 12-month period when you were eligible, but you did not enroll. Now, for Part D, it's a bit tricky.
Mm-hmm.
You may read somewhere that it is optional, but I'm telling you, unless you have another prescription drug coverage that pay as good as Medicare, then you must enroll in Part D. Because if not, there's also penalty for Part D premium. It's gonna be 1% extra for
Mm-hmm.
each month that
Mm-hmm.
you don't have the coverage.
So you're going to be
Sometimes the
penalized. You're going to be penalized for not having that Part D coverage.
correct. Yeah. So
Got you.
I'm not gonna delve deeper into how much and how to calculate the penalty. You can
Mm-hmm.
go to Medicare.gov. It will have the details on how you calculate it.
Right. Right.
So
This
yeah,
is interesting. So, see, this is stuff that I didn't know. I mean,
yes,
this is good information for those of us. I'm far away from 65, but see, I
mm-hmm.
didn't know that I needed to start thinking about this 3 months before I turned 65, right? Or that I have that
Yes,
3 months after. So, yeah,
mhm,
I did not know that.
yeah.
Um, so let's Let's talk about specific health needs. How can someone determine which Medicare plan is a best fit for their specific health needs and their budget? Like, let's say they've been seeing a cardiologist, for example, for the past 4 years. Like,
Mm-hmm.
how do they determine which plan is best for them?
Right. So, first of all, they need to look at how much healthcare needs they need, of course, and the budget, because some people think, and I think I agree with this. If you have the money to pay, I think Medicare Supplement um, have a really really good coverage because it pay most of the costs, and
Gotcha.
but it does come with the premium, right?
Right.
And also it gives you the flexibility to choose any doctor, because you can imagine when you are in a situation where you need a good, or at least the best healthcare or provider I want to go to this doctor that I want to know, and that I heard it's good. So
Mm-hmm.
Medicare supplement, uh, you know, um, it can be what you need, to do all of this, to do the treatment that you think that's gonna be intensive in the next couple months, maybe, or in the next year. And you can change later on if you want after everything's you know uh, taken care of, and then you think, oh, I cannot afford this, then you can change to Medicare Advantage plan if you want to, and if it's necessary. um, beside the budget, your yeah, the healthcare issue also, if you're healthy, probably HMO is just fine, right?
Right.
Or a PPO plan is also fine because they have lower premium. Again, that's why this is something usually that I like to talk and ask my client, hey, do you have any treatment that you're gonna schedule in the next few months? You let me know how often do you see your specialist or doctor. So that's when I can get the idea what to recommend to them. If they're
Yeah.
healthy and they try to save money because they're all fixing, okay, well, let's look at the HMO, maybe it's fine. And then if you stay always, your specialist, your doctor is in network anyway, then, well, HMO is actually very, very good plan. Yeah.
Okay. What
Hmm.
um what are some of the common misconceptions about Medicare that you encounter?
Well, there are a couple. So the first one that I can think of is, for example, someone who doesn't take any prescription, and they think, well, I'm not taking any medication, I should not, I don't need to enroll in Part D plan. And then they find out later, oops, that there is penalty because of the gap. And yeah, I often see that happen. It can be, like couple years, it can be translated to a couple dollars up to, couple 50 or $60 just because they don't know about it. And it's actually preventable as long as they get educated, right? You need to be proactive to find out about this. Now, the other thing, sometimes people think that Medicare covers dental or eye checkup, or give the benefits such as the over the counter or the grocery, they often see at the TV. So on the TV or the internet, it say, oh yeah, Medicare can give you this and that. And then they call me back, oh, Medicare, does Medicare give this to you? I want it too. And then, no, Medicare does not do that. Only certain Medicare plan that cover those extra in their plan. Now,
Oh, interesting.
yeah, yeah, I know. And the other thing is also about the insurance agent. Now, some people think that agent is just there to make sales.
Hmm.
um, so they don't want to work with an agent. They take the hard way to find the information themselves, to do their Medicare planning, while having a knowledgeable, experienced agent can make so much difference in your
Yeah.
Medicare journey. So yeah, that is one misconception, because most agent I know actually work, and put their client's best interests first. And that's why I said, just try to find a licensed agent who's knowledgeable and experienced, and start asking your friends and family for recommendation. And the key is to find a local agent, because many enrollment problems arise from working with agents at a call center or not
Yeah.
local,
Yeah.
and who are not familiar with the healthcare landscape in the area.
Yeah. No,
Yeah.
that makes sense. I always recommend people go local if they can. Um,
Yeah.
what are some of the key changes or updates to Medicare that people should know about for 2025?
Right. So what's big for this year is the improvement um, for prescription drug plan.
Okay.
So there are a couple things that change in the Part D plan. For example, this year they lowered down the threshold for the drug costs from 8,000 last year to only 2,000 this year. And then it really give great benefit for people who are using expensive medication. As you can imagine, from 8,000 to $2,000, that is a great help for them.
Yeah, that's
Um,
significant.
it is. So that's the big changes, and that's why you see, some plans now they may have new deductible or higher premium. That's to compensate the change. And the other thing is there's no more donut hole or the coverage gap.
Oh, that's
So
good.
yeah, I know people dread that, and they hate it because if there's donut hole, sometime later, maybe in October, or, November, they have to pay higher copay for their medication, and then for this year again, there's no more a donut hole. Means everything will be just smooth, one copay the same throughout the year.
Well, that's a
And
relief.
then, yeah, that's the big one. And also, one last thing with prescription drug plan change is that they introduced the Medicare prescription payment plan. Um, so this is very good for people who pay easily $2,000 during their first 2 or 3 months. Now they give you the option to enroll into the payment plan. So instead of paying that much in the first month, you can spread it out
Hmm.
throughout the year to make it easy for you to pay every month. Yeah.
Oh, that's cool. So let me
Yeah.
ask you this. So, how does Medicare coordinate with other types of insurance, such as VA benefits or Medicaid? Because San Diego's a
Yeah.
big military town, so we have a lot of
Yes.
VA, right?
That's true. That's true. We have a lot of people who have VA and also Medical or Medicaid, the Medicaid of California. We call it Medical. So let me start with Medicare and Medical first. So for those people who have Medicare and Medical, we call it Medi-Medi. Medicare will pay primarily and Medical will pay secondarily. Means they will coordinate their benefit and the payment. So Medicare will pay first and Medical will pay second, and then in the end, the individual it doesn't have to pay the costs of their services. Now the
That's
thing is,
cool.
it's just yeah, it's just very important that the individual needs to show their Medicare card or
Hmm.
their member ID card with their medical card. So they
The
have to
both. They
show
have to
those two
show
cards.
both
Correct.
at the
So
doctor's office.
correct. Whenever they have received the treatment, just make sure, hey, I have this. So please bill them correctly. Yeah,
Hmm.
don't send me any bill. So again, yeah.
I don't want the bill. Don't do it.
Yes. Build them correctly, then they know. That's a good thing about Medicare Medical. They can coordinate benefit. Now, for people or for veterans with Medicare, Medicare and VA benefit does not. I mean, they don't coordinate their benefit and payment. So you must separate or treat them separately because they don't
Mm,
pay they don't have this coordination who's going to pay first or the second. No,
right.
it's separate, and they so you cannot build them together. The veteran can just either use Medicare completely at the civilian providers or just use the VA system.
Gotcha.
Yeah, there's no coordination.
Okay, so it's just one or the other for VA.
Correct. Yeah.
Gotcha.
Yeah. But VA, I mean, veteran is good. It is a good idea to have Medicare if they want the options
Right.
to go to see other doctor outside VA. Yeah.
Yeah. And VAs are good. Veterans benefits are very, very good anyway. But yeah, it gives them the option,
Mm-hmm.
like you said. So
Yeah.
that's really
Mm-hmm.
cool. So
Yeah.
in the intro, I mentioned that you teach Medicare 101 classes. What are some of
Mm-hmm.
the most frequently asked questions that you get from people when you do classes at senior centers?
Right. So, number one that they always said, "Oh, Medicare is so confusing." So Medicare is so confusing. There's so many parts and rules and penalty, and most people are afraid with penalties, and
Hmm.
that's why they want to avoid that by coming to my seminars or the others. Um, they also want to know their options. So besides they want to know how to avoid the penalty, they also want to know their option, to know what Medicare supplement is, what Medicare Advantage is, and how to choose between the two, because they somehow it can be, they just thought, well, Medicare supplement, Medicare Advantage is kind of like, okay, the same, it's all supplement.
Yeah,
But it is not. it
it's
is it is
different.
different. Yeah, they have different characteristic, they have different premium and cost. And the other thing that I heard the most is actually about how to delay enrollment, because a lot of time and a lot of people nowadays, they work past 65.
Right.
Yeah, they work past 65 and they want to know if it's safe for them to stay with their group insurance or if they should enroll in Medicare. And they don't want to incur any penalty because they want to stay with their group insurance. So, yeah, those are the things that I heard the most.
Nice. So let's talk about some what is the advice you would give to someone like myself, for example, or anyone listening, helping a parent or loved one transition onto Medicare? What would be the best advice for someone like me who's way far off from even getting Medicare? What would you tell me? What would be the advice?
Yeah. So, my number one advice is to find somebody, right? Your local agent that you can trust. Trust me that you don't want to, deal with this yourself. Um, it will, having someone you can trust and it's experienced and knowledgeable will help you and your parents greatly. So that's my number one advice. Also, for the children, try to be patient and more understanding of your parents' situation and preferences. Because sometimes one idea that you think is best for them, maybe, well, it's more cost efficient, right?
Yeah.
Maybe not the best though for your parents who prefer conveniences or the flexibility to choose any doctor they wish, because
Right.
they prefer and they value more, their health.
Right.
So just try to be more understanding and be patient, because in the end, they are the one who's going through all of this, and they're the ones
Correct.
gonna use the health plan,
Yeah,
right?
exactly. It's not us that's going to be doing it.
Yes, yes.
Not
So
not yet,
yeah.
not yet anyway. We're further down the road. We're further down the road.
Yeah, yeah. So,
Yeah, well that's good. So, if somebody is kind of just getting started on this journey and they're not ready
mhm,
to make the phone call to you right now,
mhm.
what resources or tools do you recommend for people trying to understand Medicare options?
Right. So the number one tool I would recommend is actually Medicare.gov.
Okay.
Medicare.gov is just, I mean, we use it all the time.
Hmm.
I'll be honest with you, we are as agent, we also use it all the time. So Medicare.gov has a lot of information on what they cover. You can search with provider who accept Medicare. And also, if there's any treatment that you want to know, hey, does Medicare cover this or not? You can just search Yeah, you can
Okay.
search. Okay, then it will pop up, tell you, okay, what if Medicare cover or not, and also it will help you also to find a Medicare plan in your area. For example, earlier I said that before you enroll in prescription drug plan, you just want to make sure your party plan cover all your medication. So the tool on Medicare.gov also help you with that. So you can put in this is the this is the medication that I use, and then the system will tell you what plan that they recommend to you.
Okay.
So again, Medicare.gov is a trusted because it is government website anyway, and then that's the tool that I really really recommend. Yeah, for
Okay.
people who want to know the information about Medicare.
Nice. And
Mhm.
if someone is like, I need to talk to Esther today, how do we get in touch with you? Tell people how they can get in touch with you.
Yeah, certainly. Well, you can call me at 858-432-2322. That's my direct line. You can also read more about me on my website, www.stinsured.com, or yeah, stinsured.com. And that's on the website. You can also make appointments. You can schedule an appointment with me on my website via my Calendly, and you can choose Zoom meeting if you want. Like a lot of people, like okay, I'll just schedule Zoom meeting with you, and then we'll talk and chat about Medicare. Asking sometimes people are just asking me question for their parents, or
Right.
and so that's how you can contact me.
That's excellent. Is there
Hmm.
anything that I didn't ask you that you think is important that people need to hear?
Right, so I think there is one thing that I think it's yeah, so I want to explain about Medicare saving program because I know seniors with fixed income or limited income may find this beneficial for them. So, Medicare Saving Program and Extra Help is a federal government program to help to pay for your Medicare premium, your copay, and then the co-insurance. The Extra Help is just the help to pay for your prescription costs. So if you feel like you are on a limited income, I highly recommend for you to apply for those programs because that is really, really good. And the way you do it is just you go to Social Security website. There is an application for you to fill out for the extra help, or if you feel like you might qualify for the Medicare Saving Program or Medi-Cal, you can contact San Diego County Human uh, Service Agency and try to call them to apply or to get interview. And who knows that you can apply. Nowadays, they don't see, or they only check your income. They
Okay.
don't check your asset anymore. So who knows that maybe in previous year your parent or someone didn't
Didn't qualify?
didn't qualify for it because
Yeah.
they checked the asset, but nowadays they may. So try to do that. Yep.
Okay.
Hmm.
See, you are a wealth of knowledge and a lot of this stuff I didn't even know. So this is good. I mean, for me,
Thank
it's been
you.
like when I started doing research and I was like, Medicare, in
Hmm.
my head, Medicare equals mystery. Now, what you've done
Yes.
is you've taken this and you've demystified that mystery. And
Yes.
yeah, so it's not so
Thank you.
mysterious once you just get answers to the right questions, right?
Yes. Yes. Hmm. That's why I
Esther,
said get a trusted local agent.
yeah, well, and that's helpful.
Yeah.
Anytime. That's what, I tell, even in real estate, selling houses, I tell people, get a local person. Do not get somebody from Orange
Yes.
County to sell your house in
Yes.
San Diego and vice versa, because it's just,
Hmm.
it doesn't make sense because I'm not the expert in Orange County or Riverside. I'm the expert in San
Correct.
Diego, right? Like, I
Right.
know San Diego County. I don't know Riverside or Orange County or LA, right? So,
Yes.
yep.
Yes.
Same thing applies to real estate when you're selling houses too. Esther,
Yes.
thank you so much
Correct.
for joining me. I really appreciate you.
You're welcome. Thank you so much again for having me. And I will be happy to help if you have any question or maybe you know somebody, just contact me or shoot me an email. I would be happy to help.
Awesome. Esther, thank you so much. And we will catch you all on the very next episode of Moving Mom and Downsizing Dad. Until next time, goodbye, everyone.
All right. Bye.